That's a great question. So in terms of helping patients decide what the best procedures for them are, I really defer a lot of that to Dr. Ransom. He's the one that will ultimately decide if this is something that we think we can do for a patient. And I would say most of our patients have very realistic goals for their procedures. Every once in a while, someone will come in that wants something that maybe isn't possible or isn't within the scope of our practice. So that's a conversation they have with Dr. Ransom. But after that conversation with him, then it's about finding out exactly what that patient wants in terms of the big picture. Are they really looking to feel better about themselves, to have more confidence? Is this something they've been thinking about for a long time? Making sure that all of their questions around that are answered. When they have concerns, it's usually about things like lab testing or medications they're taking. A lot of times they ask questions about general anesthesia. A big question I get is, what kind of anesthesia am I going to get? What can I do before and after the procedure? Like, can I have food or water? When do I stop eating? Also, how am I going to feel when I wake up from anesthesia? A lot of patients have experienced nausea with procedures in the past. So I just want to put their mind at ease and let them know that we will do everything we can to keep them as comfortable as absolutely possible. They also ask questions like, how long am I going to stay? Is it at a hospital? Do I stay overnight? And the good news is we operate out of an outpatient ambulatory surgery center. So they always go home at the end of the surgery. So there is no hospital stay, which can be a big relief for a lot of patients. They also ask a lot of questions about, should they plan for someone to be with them after their surgery? If so, how long? What absolutely is necessary? Do they need nursing care? We just want to make sure that they have the answers to all of those questions and that they know exactly what their next steps are.